Again, welcome to our session, starting soon. All right, I think it's a good time to get started. Welcome everyone to our UC Tech presentation for the 2023 UC Tech. I am Jill Walters, and welcome to our session, Disabled Technologists in Inclusivity in a Remote First World. Again, I'm Jill Walters. I'm the Digital Accessibility Program Manager at UCSF. My role is in Central IT. I'm also a member of the UC-wide Electronic Accessibility Committee, and my program at UCSF is guided by the Digital Accessibility Advisory Committee. I'm happy to co-present today with Kelsey, a former UCSF IT coworker and a former member of that Digital Accessibility Advisory Committee. Kelsey previously submitted this presentation and then started a new job outside of UCSF. So I am thankful for Kelsey to commit to making this session happen and for reaching out to me to help co-present, as I've learned so much myself from developing this presentation with her. And I hope you learn a lot too. I'll turn it over to you, Kelsey.
Thanks, Jill. Hi, everyone. I'm Kelsey Kuzo. For those of you I haven't met, I was a senior Tableau developer at UCSF until very recently. I recently started as a senior software engineer at Quantively, which is an AI-driven healthcare platform that is working to make radiology data more accessible and to use it to streamline operations. We're working to make positive changes like increasing access, increasing patient and staff satisfaction, helping departments with costs, and working with reimbursements. We're using our unified data layer to provide better care to more patients at a lower cost. So we're going to go ahead and talk about inclusivity now and diversity.
Great. So to introduce you to our topic, we'll start out with talking about different types of disabilities. For example, there is visual, auditory, mobility, cognitive, neurological, medical, psychological, and many times people will have multiple disabilities. For example, Helen Keller was blind and deaf. Or for another example, Stephen Hawking could not have done his job without adaptive technology. He would have been unemployed. And also people have hidden disabilities. So you might not be aware that they have some different abilities than others. And also, like me, I'm wearing glasses. This is my assistive technology for my vision. And a lot of us also may move in and out of the disability world. Some folks have short-term disabilities or what we call temporary disabilities. Think of a broken wrist where you've lost mobility and you can't use your mouse. Let me turn it over to Kelsey to talk about some of our other topics that we'll be talking about.
Thanks, Jill. So we're also going to be talking about building accessible teams, especially in a remote first world. We're going to be touching on long COVID a lot, as long COVID is currently one of the disabilities that has the highest number of people that have it. And I'll also share my accommodation stories from different employers. I've worked for 4 different employers since I became a person with disabilities, and each of them was very different. So diversity is really important in technology. When we're developing products and tools, it's important that we can put ourselves in our users' shoes to know what their needs are. And when a team doesn't have representation from different minority groups, it can be difficult to imagine what those customer needs are. Additionally, many of us work on technologies that are patient-facing, and the percentage of people that have disabilities or chronic health conditions that are medical patients could be much higher than the general public. Diverse teams do much better in the workplace, and this applies to all types of diversity, not just disability inclusion. In addition to having higher engagement, it has higher loyalty and innovation, and they also have higher revenues, 35% on average performance advantage over teams that are not diverse, and are on average 36% more profitable. So diversity really pays off when it comes to creating teams.
A little bit more about diverse teams. They are smarter. They will focus more on the facts. They'll process those facts more carefully. they're more innovative, and they're better at problem solving and decision making. So when engaged, they want to do better, and the teams will do better as a result. Remote work benefits all. Ever since the pandemic, a lot of us ended up working from home, and it benefited us with a flexible schedule. We didn't have to take that time to commute in. We've also at UCSF incorporated breaks into our schedule, so we're not working at the top of the hour for a full hour meeting. We usually have a 5-minute or a 10-minute break between meetings. So that helps all kinds of folks that are juggling family needs, personal needs. And we want to just put a little plug in there that, return to work mandates may work against diversity, equity, and inclusion. When you're doing remote work, some things that we'd like people to know about and that will benefit all of us is to provide agendas in advance, not only for people with disabilities, but maybe people that have a cognitive disability. They can absorb and know in advance what the meeting will be about. And also, we'd like to have team leads and managers try to limit scheduling last-minute meetings that interrupts the workflow and can be a little disconcerting. Also, if you could allow recording when requested, that way folks that have different ways of learning or engaging, they can be more engaged during the meeting and not have to worry about scribbling notes. They can always go back and watch a recording later on their own time at their own pace. Another thing for Zoom, if you could also have captions turned on by default, that's one less click for somebody that needs the captions, and those that want to opt out, it's just one click for them to turn them off. And also in Zoom meetings for cameras, if you could make that optional. There's sometimes when people feel well enough to be on camera, and there are other times when they don't. And it might not also be just about feeling good or not. It could also be other situations that are happening in their life. So again, remote work benefits all of us, but it will be necessary for some. Some actions that leaders, team leads, and managers can take today is to create that safe environment for open communication and offer these remote options. Consider job flexibility and be open to change. Hopefully this session will get you thinking about that. For employers, reevaluate benefits and paid leave policies. And another one is invest in peer or mentorship programs. For example, just don't have one person solely responsible for something. If they're in a team situation, one can pick up for the other and nobody is left hanging. And also, just along the same lines, encourage collaborative work systems. This will help us all do better work together. One note about assumptions, knowing that somebody has a disability or knowing a disability may impact cognitive is not a valid reason to assume an employee cannot do the job. If you're unfamiliar with disabilities and you think Googling it will help you understand it, that might not be the case. Better to have that one-on-one conversation, because as humans, we're all different and we all have different needs. Some myths about accommodation requests. Some of these were new to me myself. So first myth, employees must disclose a diagnosis to get accommodations. I thought that was the case. Probably a lot of us do. I found out working with Kelsey that you only have to disclose the limitations and the help that you need and the requested accommodations. Another myth is people or employees and students are looking for an unfair advantage. Really, in reality, the fact is that they're seeking a level playing field so they can do the same type of work. Another myth is accommodations cause financial challenges for business. Fact is, accommodations usually cost little to nothing for employers, with the average cost being only $400. The last myth is that people with disabilities take too much sick time. The fact is, people with disabilities have a significantly higher attendance reliability. I wanted to bring back the example of Stephen Hawking. He couldn't have done his job or had his career without technology. People would have thought maybe he didn't want to work or he was lazy, but he had an amazing career. He also did a little bit of Simpsons work on the side. So he was engaged and he really wanted to interact and provide good value work. So that's another person that you might want to think of. On the next slide, we have some statistics that 26% or 1 in 4 people have disabilities that are adults in the US. It's interesting that there's a concentration of them in the south of the US. But overall, just please remember that accessibility impacts all of us. 61 million adults in the USA live with a disability. This affects everyone. Building an inclusive workplace when hiring and attracting talent is very important. If disability or a protected status is revealed, again, please do not let that sway the decision on hiring somebody. And in the IT world, a lot of us are given exercises during the pre-employment hiring phase. And so make sure that you give all candidates ample time to return the exercise. This just means, giving flexibility for diverse candidates. They may be people with family responsibilities. Usually women are the caretakers and have children or elderly parents or other people in their family that they need to support. It also supports non-native English speakers, those with neurodiversity, and social economic status should also be thought of. For example, maybe your hire does not have their own computer and they must go to a public library for computer access. Or also maybe they just can't take time off from their current job. So other parts of human life and experiences, keep that in mind. Giving a short time for an exercise only tells you who is the most able to drop everything. Supporting inclusive teams. Turn this one over to Kelsey.
Thanks. So as we had talked about, remote work is really important for people with disabilities, as well as for other types of lived experience that may require more flexibility. And as a result of the pandemic, the jobless rate actually declined tremendously due to remote work. It's usually in the double digits, and it went from 12.3% to 5.8%, which is the lowest it's ever been since they've started reporting it. It's important to remember too that including these people on teams does increase the ability to work together and to have diversity and representation, which again is important when we are working on products that people with disabilities may be using. It's really important to proactively work to ensure that all mandatory trainings and HR processes and policies are accessible when we're looking to support inclusive teams.
Spoon theory. This is a topic that was new to me that Kelsey introduced me to. It's a metaphor for quantifying energy as spoons. So people with a chronic disease only get a handful of spoons a day. It may vary from day to day and it will vary from person to person. If you want to read more about the spoon theory, I wanted to just read out one of the URLs. It's butyoudon'tlooksick.com. So keep in mind that this theory of spoons, it's going to help explain the limitations of chronic fatigue, chronic pain, and other complex illnesses. And as a simple method of pacing, people can actually manage their activity levels in order to prevent harmful overexertion. People with chronic illnesses have to ration their energy for certain tasks. So when you're out, you're out. People with disabilities, if you simplify work processes as a team lead or a manager, it's going to help everybody. And especially it's going to save spoons for people with disabilities so that they can do the great work that they need to do. On the next slide is just a visual representation of, say you only had 12 spoons a day. How would you use them? We made this focused on if you had to go into work and you could not do remote work. So coming into the office and you've got 12 spoons. So somebody might take them 4 spoons to shower, dress, do their hair. It might take them 2 spoons to drive to work. And then another 2 spoons to walk from the office to their desk, to meetings, to lunches with coworkers, to the printer room. Meetings might take 2 extra spoons. So keep the meetings focused and short and to the point. This was really interesting to me. Water cooler talk could take extra spoons too. You think, extra spoons as, as water cooler talk is something that's easy to do. But if you think of the analogy, say you're going to have a 5-minute phone call with somebody. If it's your best friend, that 5 minutes is a breeze and takes low energy. But if that 5 minutes is a phone call with an angry mother-in-law, that's going to zap more of your energy, same amount of time. So think of keeping your spoons to do your quality work. So for Kelsey, it's actual development work. Say it's 4 spoons. So if you added up all of these spoons for the day, she would be short 4 spoons. And then tomorrow she's only starting with 8 and she's still at work. And so the idea of working remotely can help people with disabilities save their spoons.
Thanks, Jill. So long COVID, is it a disability? According to the ADA, a disability is a condition where, or any of a condition's symptoms that is physical or mental impairment that substantially limits one or more major life activities. And so according to the ADA definition, in many cases, long COVID is a disability. Studies estimate that long COVID can occur following 10 to 30% of all COVID-19 infections, and that it's responsible for at least 15% of the current labor shortages. 16.3 million people, 8% of the working population, have long COVID symptoms. And of those people, about 25% of them have a specific type of organ damage or damage to a specific organ. But the other 75% have something that is very similar to ME/CFS, which is it's a post-viral condition. Some of these people may recover. Usually if they've been sick for less than a year, their chance of recovery is much higher. Others may return to work with accommodations. So understanding long COVID, it's a very complex illness, and many people are not aware of how to support people with this illness. It can impact any body system and oftentimes impacts multiple body systems at once, which makes diagnosis especially difficult with our medical system, where we have specialists that focus on particular body systems. Many times by the time people have a diagnosis, they have seen several different specialists and have been getting passed on to the next specialist and the next specialist because each one says that there are things outside their specialty and therefore they can't make a diagnosis. I briefly mentioned ME/CFS before. That stands for myalgic encephalomyelitis. It is a condition that has been caused by numerous other viruses throughout the last 50 or so years that we've been aware of it. The average time that it takes for someone with ME/CFS to get a diagnosis is 8 years. And as much as 90% of the people that have it aren't diagnosed. So the symptoms that most often impact work are fatigue is the top one, and then brain fog, which is some of those cognitive difficulties, right? So it can be issues with memory or recall, or sometimes with learning, depending on the person. It can cause tinnitus, which we've all heard about with long COVID, smell and taste disorders, as well as GI issues and allergies. I, for example, am allergic to almost any synthetic fragrance, which makes it very difficult for me to be in public around other people without wearing a mask and taking precautions. Can also cause shortness of breath, and sometimes people faint when they stand up. That's because of something called orthostatic intolerance or dysautonomia. It can cause sensory issues as well, and PEM, which we will talk about. So PEM is post-exertional malaise. It is a worsening of symptoms following any type of exertion. It can be like physical exertion, or it can be mental or emotional exertion. And oftentimes what we would think, what healthy people would think of as exertion is not what we're talking about here. We're not talking about somebody that went out and ran a mile or went to a concert last night and stayed up too late. We're talking about somebody maybe that had to pick up their groceries and that was too much exertion for them. Typically the symptoms start about 24 hours later, next day. So A healthy person, if they exercise too hard, they'll be tired and sore afterwards, right? A long COVID or ME/CFS patient that exercises or exerts themselves too hard might feel great afterwards. Me, for example, I miss being able to do things that are very active as a form of stress relief. And so if I overdo it, I usually feel better. But then the next day, they have flu-like symptoms that can last for weeks or even months. It's the cardinal symptom of long COVID and other post-viral syndromes, in that it doesn't exist, as far as we know, in any other condition except for ME/CFS and long COVID. And many researchers will say that long COVID in many cases is ME/CFS, just caused by a new virus. MS causes something similar, but it's much less severe. So as I've said, I'm a person that has ME/CFS. It's essentially long COVID. And before I got diagnosed, I was encouraged to continue to exercise. It was something that was supposed to help. It helps. Many people with many different types of illness do benefit from mild to moderate exercise. But with ME/CFS, it can actually be really dangerous. I used to hike 3 to 5 miles 3 times a week. And one day just flipped, and all of a sudden I couldn't walk for more than a block. This is the permanent increase in severity that we're talking about. And it took me about 2 years to get back to being able to do much activity at all after that. But I'll still probably never be able to hike again, according to my specialists. So at its worst, PEM can trigger a permanent worsening of the illness. And at its worst, people that have ME/CFS that are in the most severe category are some of the sickest people in the world. They oftentimes can't tolerate interaction with other people, have to have all kinds of sensory information shut off, like wearing soundproof headphones and blindfolds every time their carers come into the room. Oftentimes they're confined to bed 24/7, they require round-the-clock care, and they're unable to do any of the activities of daily living. Oftentimes they can't even sit up and need to be tube fed to stay alive. So it's really critical that people that have ME/CFS or long COVID try to avoid PEM. And it's impossible to avoid it all the time. It happens, but it's important not to get into what they call the push crash cycle, where you're triggering PEM over and over and over again, and you're pushing to try to get through it. And it just makes it worse and worse and worse until you wind up in a position where your disease severity is so severe that you cannot function. So again, PEM is everyone with ME/CFS and about 75% of people with long COVID. And the disease can vary a lot in severity, but PEM episodes lead to an increase in severity. So it's important for people that have either of these illnesses to do something called pacing. As a leader, how can you help employees that you may or may not know your employees, your team members have a disability? Many times people aren't comfortable talking about it. So how can you build an environment that's safe for everyone? You can encourage pacing and provide flexibility. You can learn about long COVID, especially because it is such a huge proportion of the people that are trying to re-enter the workforce or stay in the workforce in some cases. And this can make a difference in an employee's ability to continue working and even to improve their condition. Your actions as a leader can make a tremendous difference. It's important to know that an employee with long COVID or with ME/CFS will have abilities that can vary a lot from day to day. And this doesn't mean that they're faking. Just because I could do something yesterday doesn't mean that I can do it today. But just because I can't do it today doesn't mean I won't be able to do it tomorrow. And learning capabilities and limits is something that is very challenging with these diseases. But once someone who has these diseases learns about their capabilities and about pacing, oftentimes they can set their own boundaries and be as productive, if not more productive, than many other people in the workplace. For example, I've been a successful technologist with this illness. I have learned most of what I know about technology while I was sick. I've learned 7 programming languages. I've learned data analytics, data science, data visualization. And all of this I've done while I've had those cognitive impacts. Targeted and experimental treatments have helped me a lot with maintaining and regaining my cognition, but there have been days where, I'm not 100% and nobody is 100% all the time. But with careful planning, it has not impacted my career in any negative way. I also wanted to mention that the best treatment that I have ever found for myself just came out or just was discovered to work for this illness in November of 2022. That's less than a year ago, and it has been so incredibly impactful. But the point with that is that because there's so much research funding going into long COVID, there are many new treatments becoming available for other people with post-viral conditions as well. New things are constantly being discovered.
So Kelsey, mentioned about, she helped me understand that myth that you don't have to have a diagnosis before you can seek accommodations. People don't know much about that. But I think there's also another story here from Kelsey. She, about her path to just being diagnosed. It's not usually just a one doctor appointment and you get a note and there you go. You want to talk a little bit more about that, Kelsey?
Sure. So it took me 26 specialists and 3 years of illness before I got an accurate diagnosis. And now I have a care team of 8 specialists. And again, because of our specialist system, that's pretty typical. It's how many people it takes to treat the entire illness. And as you can imagine, that leads to quite a few doctor's visits. There still are no specialists that treat ME/CFS that I know of in the state of Virginia, which is where I live. And so my primary doctor that I see is in New York State. And the other doctor that I see most frequently is at Harvard in Boston. And so many times I'm using vacation time once or twice a year to go to doctor's appointments. I also have an average of 3 appointments a week. And so having that flexible scheduling is incredibly critical. And again, it hasn't negatively impacted my career at all. I'm very lucky to be able to get the kind of medical care that I have. As many as 75% of people pre-COVID that had ME/CFS could not work even part-time. And a large part of that was because it is so difficult just to, get to and from the office, to be able to attend your doctor's appointments while maintaining a full-time schedule, things like that. And so I don't know what those numbers are now. I wish I did. I'm sure in a few years we'll find out, but I'm quite sure that more people that have these severe disabilities are able to work than ever before. Anyway, before I was diagnosed, I was able to file for accommodations just by disclosing what my limitations were. I started having some mobility impairments and needed to walk with a cane. And I started having some fatigue issues where doing too much physical activity was difficult. So things like, walking really far to appointments where I would have other colleagues that would do it together on campus when I was working at the University of Virginia. Things like that were difficult for me to do. And I needed to file for accommodations. But the services were available despite not having an accurate name for what was going on.
How have employers supported you in seeking accommodations?
So I have worked for 4 main employers in the last 6 years since I got sick. During that time, I've never formally disclosed what my diagnosis is. In fact, this presentation is the first time that I have talked about it to a lot of people that maybe I don't know well. I have informally told a couple of my leaders in the past who I have trusted and known wouldn't treat me differently when they've asked, but I've never formally diagnosed it or never formally disclosed it rather to HR. So I'm a knowledge worker, right? I was a developer, now I'm a software engineer with a disease that when people look it up, the first thing they see is that it causes cognitive issues and memory issues. So it's intimidating to disclose something like that to an employer because it seems like I will be judged. But again, despite that, I've been a successful developer, an analyst, a data architect, and a data scientist with this illness. So it's important to know that you don't have to share your diagnosis, even if you have one, and that your employees do not need to share their diagnosis to be able to get accommodations. I've been sick since I was 27. When I was 27, I woke up one day with a rash on my face, and they thought it was shingles, which I was 27. I was healthy as far as I knew. So getting shingles was pretty weird. But since then, it caused viral meningitis in my spine a couple of times, and continued to be a problem and caused Epstein-Barr reactivation, which we found is the core for many of these illnesses. So I've worked the entire time I've been ill. A large part of that has been because I've had a caregiver that has been able to help me with my activities of daily life to save those spoons, like Jill was talking about before, so that I can do what I'm really passionate about. And I've also had the ability to work from home. The shift to remote work from the pandemic was very helpful for a lot of people. So I'll start to tell you all a little bit about what it was like with each employer, because actually the process was incredibly different for each one. When I was working at the fintech company, I didn't disclose it during the interview process because at the time I wasn't walking with a cane or anything. The disability was considered invisible. And by the way, now I'm a wheelchair user, so I have to disclose because people will know. It was a formal process. I met with the HR representative, and they had paperwork that I had to fill out with multiple doctors. Then I went back to meet with them with it all documented, and they agreed to meet about half of my accommodations requests. So the second company, or the second place rather, was a large state university school of medicine. It was very different before and after COVID. So I disclosed the disability during the interview process. I was already walking with a cane at that point, and so I figured it would be obvious that I had a disability, so I might as well disclose it. I do want to say it's a very personal decision whether someone decides to disclose something during the interview process or not. There is not a right answer, and it is perfectly fine for people to either disclose or not disclose based on their own comfort levels. So pre-COVID, we worked in person at the large state university school of medicine. My mobility was getting a lot worse, and even though when I left, they replaced me with 3 people because that's how much work I was doing, the hardest part of every day was getting to and from my desk. Even though I had a handicap placard for my car, I had to park pretty far away and take a bus and then walk up a hill. And then I couldn't get permission to park closer, unfortunately. They also said that they would never allow remote work. And then COVID happened and everything was remote work. So post-COVID, I was able to work productively, even though my illness was getting a lot worse. This was still before I had an accurate diagnosis. So during that time, I hired and supervised 3 contractors. But despite having been on the leadership track before things went remote, I was told that I couldn't be promoted formally to a manager without being back on site once the pandemic was winding down. I couldn't work on site anymore because of the mobility issues. I was a wheelchair user by that point, and I had chemical sensitivities that cause anaphylaxis. So working in an office would have been tremendously difficult and bad for my health. At that point, I formally filed for accommodations to work remotely, and I was given a form. I had a doctor fill it out. It was very casual. It was accepted that I could work remotely indefinitely, but I was still informed that I couldn't be promoted. So then I worked at UCSF. I disclosed it during the interview process. Even though the job was 100% remote, I made it clear that I could not travel without accommodations, which was something that had come up. I didn't need to file for accommodations until there was a required training that was not accessible through a third-party vendor. At that point, I met with the HR representative. I provided a letter from one of my doctors, and the process was very quick. I didn't feel like it was difficult. I felt heard. I received accommodations for the on-site training, and for UC Tech, I was planning on attending in person before I had left to travel with my caregiver due to my disability, and none of it was a fight. Everyone was very supportive. Almost immediately after I started at UCSF, I began working to help with accessibility, especially with data visualization for color blindness. And I started presenting about accessibility and disability inclusion topics. And then I joined the Digital Accessibility Advisory Committee. The first year when I was doing the introductory training that everyone has to do, I didn't know who to reach out to when it wasn't accessible. And so I paid one of my kids to come in and read to me all day. But fortunately, there are people that can help. I just didn't know who they were at that point. So lastly, the AI startup. I've been there for about 2.5 weeks now. I just closed when I was speaking with the initial recruiter. No, it's less than that. It's 2 weeks. I'm sorry. Regarding travel and mobility needs. So I just closed that I couldn't travel without help and that I was a wheelchair user. And I negotiated specific benefits as part of my accepting an offer. That is short-term and long-term disability insurance weren't covered. And they just had never even thought about it. I was the 8th employee. It just wasn't on their radar. So they were able to include that as part of the offer. And they also gave me a stipend to select equipment at their expense that would allow me to work the way I needed to. The thing is, a lot of times if people don't have a specific need, like they don't have a disability or an accessibility need, they don't think about it. So sometimes asking is really all it takes, and people are happy to help out.
Yeah, that brings us to a little bit of the story at UCSF that Kelsey had mentioned, bringing in her adult daughter to take one of the mandatory trainings that we all have to take. And so she was trying to get through that barrier on her own. Like she said, a lot of people don't know who to reach out to. When it happened again, she reached out to me since we were on that committee together, and we got her in touch with the HR department. So for anyone, HR department is your best first step. At UCSF, it's called the Disability Management Services team in HR. It might be called a different name at your UC. But the second time this happened, once it was, addressed as a formal barrier, the instructional technologist that created this training reworked the course. HR gave her an extension for her deadline. And when the course was ready, I was really happy to hear Kelsey say that she could complete the course as required.
Thanks, Jill.
And Kelsey, would you like to share some of the other resources that are outside of the UC system that you found helpful?
Sure. So I've been working with vocational rehab for quite a while. Every state has their own voc rehab program, and there is a link in this slide deck to find the one in your state. They've been able to help by providing assistive technology. They help me provide an adaptive workspace. One of the things that's difficult is that I have to lay down most of the time because my circulation doesn't really work right, and I won't have enough blood in my brain, and then I'll stop being able to concentrate. So I work laying down most of the time, and I have an adaptive workspace that they were able to help me figure out and set up. They also have paid for training before, and they have, disability focused career counseling that's really helpful for people that are trying to re-enter the workforce and maybe can't do the same thing that they used to do. Job Accommodation Network, JAN, is great for trying to find out what reasonable accommodations are and what might be helpful for certain conditions. And there are also resource groups online, especially regarding long COVID and ME/CFS. My favorite is ME Action. They're great. And I have a list of other resources here. So here are some resources for employees that have disabilities, particularly with accommodations. And we have more resources for learning about long COVID from a perspective of someone that doesn't have it at the end of our presentation.
So I wanted to say thank you again to Kelsey for including me in this presentation. Thank you for your service at UCSF and participating in the Digital Accessibility Advisory Committee, and for sharing your personal story with us today.
Thank you, Jill, and thank you for all you've done for accessibility in the time I've been here.
I wish you the best in your career.
Thank you. So we'll go ahead and open it up to a Q&A. Please use the Q&A, not the chat, and we will address as many questions as we can. Okay. One moment, please. Okay, the first question is, in terms of long COVID, obviously the best thing is to never get COVID. One of the best mitigations is to clean our outdoor spaces. Have you seen any significant tractions on this at UCSF or other places? Well, when COVID started, I personally was already someone that had, that was immunosuppressed, right? Part of ME/CFS and long COVID is that it really messes with your immune system. Your T cells don't really work much anymore, even though they're there. And so my family and I basically did the whole shelter in place thing for the first 2 years before vaccines were readily available and people were using them. But that said, yes, I think it's much more common to go to indoor spaces where, people have filters set up. I know that at the university that I was working at the time, they set up actual plexiglass barriers for people that had to go in the office, and masks were required, which is something that is still very helpful for people that have immunosuppression. But when it comes to not getting COVID, I think we've entered a place or a time rather where that's kind of a difficult ask. And we are seeing that people that have been vaccinated are less likely to get long COVID from COVID. We don't really understand why that is yet, or at least as far as I've seen in the research, we don't. But getting vaccinated does make it less likely that even if you get COVID, that you'll get long COVID. Jill, perhaps you can answer if you've seen traction at UCSF, since I've actually never been on campus.
Right, and unfortunately, I can't answer that question either. I've been remote since the pandemic, so I don't have a good feel for that. I'm sorry, I don't have an answer.
I think being remote helps a lot, and we at least at UVA, while I was working there during the beginning of the pandemic, went from having these huge crowded auditoriums where everybody was sitting right, like basically on top of each other, to having classrooms where maybe it was hybrid and most people did go remote, but a few people would be in the classroom and they would be much more spread out. I think that was helpful too. Let's see. In terms of, okay, there are no other questions. We have 1 minute left if anyone else would like to ask a question. Okay, well, I guess that's it. Thank you so much, everyone, for coming to our presentation. If you have more questions in the future, you can feel free to reach out to Jill or to I, and we'd be happy to answer those questions.
Thanks, everyone. Thanks, Kelsey.
Thank you. As a reminder, there are 2 more slides with resources that you all will be able to see after. Thank you so much.
Thank you.